You're listening to the Salty Sex Cast with Mariah and friends. Minimize the fear. Expand your awareness.
Hey, all you sexy souls, it's Mariah here with a new friend. I have Dr. Shyama Mathews, who's a board-certified OBGYN and also a certified menopause specialist. Her and I chatting before we started recording. I'm so excited to talk to you about and introduce you to this great person out there. But Shyama, do you mind introducing yourself for everyone?
Yeah, sure. So I'm Shyama Mathews, like she said, a board certified OBGYN. But in the last 6 years of my practice, I've basically just focused on the GYN side of it. So no babies, no pregnancy, just everything else a woman goes through. So everything from birth control, sexual dysfunction, endometriosis, fibroids, and menopause. And I also do minimally invasive GYN surgery. So that's the other aspect of my practice. And it's been super fun because I get to take care of women of all ages and really focus on sort of the day-to-day issues and health concerns that they may have at all of those different stages.
Yes. Because we have so many at every different stage. I mean, childbearing is just a tiny slice of our whole entire span of life. And so I love that you've dedicated so much of your time and practice and specialty to that area. Myself, having had a hysterectomy and endometriosis, it's just nice hearing that someone has dedicated a lot of time and practice around those things. I didn't have any answers. I didn't know who to turn to. And I actually put it off for way too long before I finally went in. And I
Yeah,
think, and really what got me there is girlfriends talking, us
right.
talking about what's going on, what's normal, what are you experiencing? And then us kind of just jumping in and saying, well, you know what? I was fed up. I finally went to the doctor and it's like, okay, I guess I will too. And I hated it. I hate going. I hate having those conversations, follow-ups, pre-op, whatever. Like I will avoid
Right.
it as much as possible. Me being a health intervention specialist, like it's just one of those things that double-edged sword. But for you, you've also dedicated a lot of your time around some of the other sides that aren't so clinical is what we'll use.
Right.
That sanitized down version that if I think I'm talking to a doctor about sex, I'm going to get, well, here's the this and that, very medical terms,
Right.
very sick based interventions, like only until there's a problem will we step in, but more of preventative and fun and
Yeah.
pleasurable. So tell me that side that you've uncovered for yourself.
Yeah. So, what I've also found was that a lot of people are embarrassed to ask their doctors these questions about intercourse, about sex. And so I often pose the question to them. So, are you sexually active? How's that going? And if they say no, why? Like, what's going on that you're not? Is it because you'd rather not? You don't have a partner? You don't like your partner? Or, is it something like about discomfort or libido or interest, what's going on that's happening. So really kind of teasing that out. And I can't tell you how many women will like apologize for like they think they're
Mm.
wasting my time because they're asking or curious or want to know answers to these questions. And it's me telling them, who else are you going to talk to about this, right? Like, you're not going to talk to your dentist about this. You're not going to talk to your internist about this. I'm your gynecologist. Like, yes, let's discuss this. Let's find out, what we can do for you to be able to enjoy this and, take this on and not shut down this corner of your life because XYZ, right? So yes, that is something that I've found regardless of disease state. It doesn't matter. Like yes, there are each thing has its own personal struggles, right? Endo, fibroids, all of those things has its own personal struggle. But like in general, women are often confused about sex and what is normal, what's not normal. There's a lot out there that make people think that they're not normal or something is wrong with them.
Mm.
And I think, explaining that to people and being able to talk to women about that openly, I don't know. I think that that's important to me. And
Yeah.
it's wonderful when you have a group of friends that you can talk to about that. But there's so many women who don't because they're shy, or it's not, it's not acceptable, like kind of discussion. It's sort of private. And so, they really do live in that, they kind of close that off.
Yes, and that's where I'm so fortunate to have those people that I can talk about it. Usually I'm the friend that's always TMI anyway, but it really helps you just normalize, okay. And the other thing I love to say, and I have said on the podcast so many times, just because the majority of someone is experiencing it does not mean that's also like the normal health level, right? Pain during sex or dryness or other things. It
Right.
doesn't mean something's wrong either, but it could be something that maybe isn't right. So if that makes sense.
Yes,
The
I
opposite
agree
of
with
wrong
you.
is not right. It just means better. Like let's keep moving up that cycle of our that scale of health and wellness. And I think just right now in the stage of my life and hearing girlfriends talk, a lot of them have been complaining about pain with sex.
Yeah.
And either they're just like, oh, it's normal, or is it just part of my cycle? And it's so hard for us to self diagnose because one thing is normal one day and it's different the next, and we're all over the place. And it takes a whole month for us to see if was that
Right.
part of our cycle or not. Um, and then there is a general diagnosis. I've kind of started to hear a little bit theme in my friend group and other friends is just that general pain in sex. And I am not going to remember that diagnosis. So maybe you can, it's just, or a name that's been given that can kind of help validate that, yeah, you're having pain during sex and it's not in your head and it's not to avoid it. And like some society, parts of society have made women believe or feel that we need to hold on to. But for you, what are some themes that you're noticing in your practice of what's coming up for women now finally going to the doctor?
Right. I think so dyspareunia is like the clinical
That's
term
the
for
one.
pain with sex.
Yeah.
But you can have dyspareunia for various reasons and at different stages. And you're right, like in your cycle, have you just had a child? Are you approaching menopause? So many different things that can be influencing that. Are you on certain medications, right? Birth control pills can do it. Like, so it's not like there's something wrong with you as a person for having pain with sex, but you're right. I think women sort of expect that certain aspects of sex are going to be painful, and they sort of swallow that and just live with it. And many of them have been told that, unfortunately, like that, oh, it's just your lot in life. This is just what it is. Like, suck it
Mhm.
up. And I think that's terrible. So I just, I start out with all of those conversations just being like, sex should not be painful. Sex should be pleasurable. It should be enjoyable. It should be a give and take between both partners in such a way that they're both experiencing sort of the best. It's not, one person doing all the giving and the other person doing all the taking, and the giving person just being, putting up with whatever is uncomfortable or painful. So different
Mhm.
things like that, especially that I feel like people don't talk enough about. And then I got involved with Playground, which is a sexual wellness company that has its own type of personal lubricant that they designed to be specific to meet the needs that women need, like being able to balance the microbiome and clean products and all of that.
Mm.
I got involved with them because they really were focusing on making something like lubricant generalizable, right? Like just able to say that everyone, universal, like everyone should be able to use lubricant, not because there's something wrong with them and they need it, but because it can actually enhance their experience. It can make things better. It can, move the needle forward of like what they can experience sexually. So taking that conversation and bringing that to patients for me is sort of something I enjoy talking about with people, because I feel like that doesn't get enough attention.
Mhm. So teetering those scales from not just the, prevention of disease or a diagnosis or illness, we can say, but let's tip it to more pleasure,
Yeah.
more validation of what I need as a woman in my sexuality. And that's lube, everyone. If you don't think if that's not for you, let's have a conversation. You turn up your dial and really tune in, because that really is, I think it was something, and if I haven't already said, TMI is not a thing for me. My partner got overly excited and really, it was right at the beginning of our intimate session, and really pushed himself in there. And I was like, ow. And he was like, why? You were already wet. And I was like, whoa, whoa, whoa. Let's talk about this. I have a self-cleaning oven. I'm decently wet most of the time. Things are moving down there. There's going to be some type. But I was not like either erect or there wasn't other sensations down there that was telling my body, hey, this is time. Be prepared for something entering. And so it was just like this moment of me lecturing my spouse. It's like, whoa, whoa, careful
Right.
there. And just but you were wet. And I was like, sure, but then I can dry out really quickly, because it was wet enough to maybe for you to enter, but it wasn't wet enough for us to have a full sexual session. And so I think that's really important too, because just because it's enough to get started doesn't mean you're going to stay lubricated enough to enjoy it the whole time. And that's not a sense of oh, I'm turned off halfway through the sexual session either. And I think that's something that's sometimes hard to tell a partner, and it's like, really, I'm just drying out. Sometimes that's what happens.
It
Sometimes I'm
happens.
overly
Yeah.
wet at the beginning and not so much towards the end.
Right.
So lube's your friend. Just make friends with lube. And playground is one that's particularly made for the needs of women's bodies, is what I'm hearing.
Yeah, that's I think what I found so unique about them, compared to what has been sort of generally available on the market. It has always been sort of a kind of an old stale recipe that honestly wasn't really focused on, again, women's side of the pleasure aspect of it. It was sort of like a, you just use it because you either need to, but it really wasn't focused on what's good and healthy and um, accommodating to the needs of the vagina, right? It is such a complicated piece of the body that you're right. It's not just about being wet. It's about, um, there's a whole different, levels to sexual experience, right? So if you don't actually make progress through them, you'll never get to the point where you're actually enjoying it enough to climax, right? So how do you move between those aspects of it? Lubricant's going to help you, moisture is going to help you, right? But you also want it to be something that's not icky, that's not messy, that's not ugh, right? You want it to enhance the experience, you want it to be better. So that was something that this was a company that focused on that. That's what they made important. It wasn't just a means to an end, let's just use this because you want to be able to actually do the act of sex. It was more like, how can we make this better? How can we make this fun? And how can we encourage women to embrace that? And that's whether it's by yourself and self-pleasuring or with a partner and, trying to improve or increase your intimacy, it doesn't matter. It's just about how is your personal experience? How is that going to get better? So that's what I thought was super cool. And that's how I ended up getting involved with them, because I was so interested in that, having that conversation.
Yes. I love that exists out there, because, there are 1,000,001 different kinds of lube out there. And it doesn't mean that one's better than the next. But there's one that's probably better for you than the next. And so you need to ask yourself, what are you looking for in that lube? There's been times I've looked at those, in a sex shop, and it's a whole wall of all sorts of different things. This one heats up, this one tingles, this one has flavor, this one is toy safe, this one is not, all of these different things. And then I love that there's all of these choices out there, but I also am not sure, is that made for me and my body?
Right.
if it tingles, is that actually healthy long term? Or is
Right.
it just a fun, instantaneous, pleasurable thing? If it's flavored, am I going to end up getting a yeast infection or some
Right.
type of reaction from this because there's like sugar or whatever, something fun inside of that? I haven't looked enough at all of them, but it has always crossed my mind. What am I actually putting inside of my body? Because this will be something that's going internally for me as a female. And so just being, able to understand that all of those can affect different stages and different areas of wellness. So like you said, our biome, our, the pH level, all of that, that something
Yes.
this is one reason we do have a self-cleaning oven. It's
Agreed.
amazing.
Yes.
But if we're harming that is there for us, it's going to be harder for that. More yeast infections, more vaginal infections, and other things. What are some other things that maybe our education has skipped over and the health of our vagina, honestly, to be prepared of what's going in there can maybe not be the best thing, even if it's
Yeah.
marketed to be
Right.
better.
So there's a couple of different things. One, I would say, we mentioned vaginal infections, but like UTIs, like how
Mm-hmm.
horrible is a UTI? How many women out there actually get UTIs or feel like they have one coming on after sex, right? How can you get into sex if you think every time you have sex, you're going to get a UTI? Like,
Yeah.
do you see what I'm saying? Like there's this loop to it that you're like, I don't want to engage because, oh my God, I'm going to dread how I feel after. Right.
Mm-hmm.
So lubrication actually really helps prevent that. And again, good quality product that isn't going to disrupt the balances in general, like just by using it is sort of the other aspect of it. So that's a big one that I feel like I see a lot of women come in of all ages, literally all ages, college students to women in their 60s. It doesn't matter. It's just one of those things like what's going on. I feel like I get a UTI every time I have sex, or I feel like there's that discomfort or burning afterwards, and I don't know, what's going to come of it. And so there's that aspect too. And then that actually kind of points to another thing, pain. You mentioned it before, like so pain with sex isn't normal, and it can actually affect not only your sexual experience in that moment, but future experiences because your body remembers, right? So if you're having sex and it's painful, sure, maybe the first time you think it's a one off, but then it happens again, and then it happens again. And then you aren't going to get as lubricated or wet because you're sort of dreading it or afraid. Your muscles actually tense up. Your pelvic floor actually learns to go into like a fight or flight response, as opposed to being relaxed and engaged in the moment, right? Like allowing
Mm-hmm.
that relaxation and that inhibition to drop, which is really key to both libido and then also climaxing, right? You can't do it without being completely disinhibited. But you won't have that if you have this link in your brain and in your muscles in your body that this is going to be painful.
Mm-hmm.
So that to me is so important. And there's so many different things that can make that a problem for a person. And walking back from that is so difficult. So preventing it from the first place, or like paying attention to it when it's happening and like, trying to get ahead of it is so important.
Yeah. So how do you get ahead of it?
So again, it's about paying attention, right? Right.
Yeah.
Like you pay attention to your body. Like you mentioned, like you noticed, that it's not just about being wet, and that when there was sort of a deep insertion, you're like, well, my body wasn't prepared for that.
Yeah.
So one, that's amazing to have that open communication with your partner that, what, it takes me a minute. It's not just about what you feel is moisture, but let's sort of enhance this experience. Let's do more, whether it's foreplay or using a lubricant, whatever it is, to get you to that stage where your body is more accepting and open. But then if there is pain, taking a look at why, stepping back and,
Mm.
kind of considering, is it dryness? Was there, something about the act, the position, whatever, that was uncomfortable for you? Is it related to size or like time as far as like how long you were intimate before, that deep insertion, whatever it was, actually taking a step back and trying to reflect on that without any judgment. Like it's just an objective, like, hey, what happened
Yes.
there? Right?
Without judgment, because there's
Yeah.
nothing wrong with you. There was just something wrong with the timing, the situation, something there
Right.
that, if we're looking at can it be avoided, let's look at this. So, what about maybe the few percent of listeners who are tuning in and is like, I have sex or I have pain every single time I have sex. I couldn't even start to begin what could be going on right now. What do you suggest on like a starting point for some of these folks who are experiencing that for themselves?
Definitely speaking to a provider that is comfortable having that conversation, right? I will have
Mhm.
visits just surrounding that. I have painful sex. Let's figure out why. And again, it's really looking sort of a deep dive into the clinical side of things. Like, are there other aspects? Are your periods painful? Because painful periods very often tied to painful sex. And again, it has to do with that pelvic floor. I don't know how many times I've examined a woman and they've been everywhere. They've been to the orthopedic surgeon. They've been to the GI. They've been to rheumatology, like everyone. And then they come and they're just like, this problem has been going on for so long. I have this pain. It's down my leg, it's in my back, whatever. And then we sort of unfold a few layers and say, well, yeah, actually I've always had painful periods, and yeah, sex is excruciating. Like I don't enjoy it at all. Anytime I do, it's awful. And I do a physical exam and I'm like, your pelvic floor is a vice. Like it's not supposed to be. This shouldn't hurt,
Mm.
right? I do an exam where I'm touching certain muscles and they're jumping. And that shouldn't be the case, right? That should not be the case. So if something is going on there, that all of the other things they're experiencing are sometimes secondary effects, like the fact that they're having a problem with their hip or their back or their leg or whatever is sort of a secondary effect of the fact that their pelvic floor is completely, in disarray. And then you have to walk it back from there. What can you do? Physical therapy, sometimes actual psychotherapy as well, because again, this psychologically, you're also kind of convinced that there's pain there for certain reasons. Where is that coming from? So
Yeah.
there's a lot of angles.
Yeah. There's a reason we flinch when someone gets close to us. We are expecting pain, if someone's
Yeah.
going to hit or slap or whatever. Um, and it's the same thing you're saying, so that flinch, that muscle, you're tightening up, you're
Yeah.
avoiding, like, it's going to hurt. And I know that exact thing. I'm like already noticing I'm
Yes.
flexing certain muscles right now. I'm like, oh, yeah, because once in a while that just doesn't feel great. It can be angle, it can be different types of anything, right?
Yeah.
But knowing that, and I think for myself, just like how I was able to like lecture my partner, like seriously with a finger up, like, whoa, not okay. That did not feel great for me because I have been able to step back and start to figure out what does my body need in certain moments and what is not okay in certain moments and um, where we're at. I mean, gosh, the different feelings and the different sensations. Okay, that is because I'm wetter right now. That isn't because this, and really just paying attention. I think that's a great way to also just tune into what works well for you. So, not
Right.
just the side of what's not working, what we want to avoid, but what's working well. Oh, I know when I am more
Right.
excited and more erect and open to that it just makes it so much more pleasurable for me. So, I need a warm up minute. I do need some of this
Yeah.
time. Or other things. And so, just kind of tuning into that can really help us start figuring out what are the pieces that we need more of? What are the pieces we also need maybe some, less of? So,
Right.
um, for you exploring these different areas, what are some misconceptions that you probably hear often, either people walking into your office or even in the medical industry?
Yeah. Misconceptions. There's like a laundry list, right? But I would say surrounding sort of sexual wellness and intimacy, I think it's it's a couple of different things. There's different ones that sort of kind of pop into my head. One, that, you know, if you're young, like, and, you know, before you've had kids, that it's supposed to be wet all the time, ready to go. Like you're supposed to be like at your sexual prime, like everything's, you know, and so if it's not, then something's wrong with you, right? Like you're not. And I hate that because it really becomes internalized by a lot of
Yes.
young women. All of these, like, you know, what you see in media and what you see in TV shows and all of these kinds of visuals of sort of like this young, sexy, like that attitude, like that you're always sort of like ready and open for sex. And it's just like, it just happens like that. And it's magical. It's immediate and magical and ready to go. And it's like, it's not true.
Yeah. Gosh, even in our pop culture of like, you know, the little, oh my gosh, it's not a GIF, whatever,
The
the
meme,
little
the memes.
emoji of
Oh, the
like the
emoji.
droplets, right?
Yeah.
You know, it's like, oh, I'm wet kind of
Yeah.
thing. Like,
Yeah.
sure, that could be something that's like it means horny or turned on or whatever, but is someone actually physically lubricated, ready to go?
Right.
And so
Right.
that pop culture piece could also be part of, you know, that's
Right.
what we've accepted to be as I'm accepting of whatever's coming, but also it's maybe just a bodily reaction. Like,
Yeah. Yeah.
yeah.
So there's that. And then the next one I would say is sort of like women after having kids. So the postpartum, um, you know, time period is so complex on so many
Mm,
levels, right? Physically, psychologically, like, I mean, it's a trip. Um, and
mhm.
it's interesting. You have a baby, you have a 6-week postpartum visit, and then it's
Yeah.
see you next year for your wellness. Like that's it. Like there's nothing in between. There's no like, this is what your body's going to go through, the roller coaster of, you know, sensitivities and dryness and pain, and forget about what kind of birth trauma you might have had. Like there's nothing. It's
Mm,
6 weeks and it's like, see you later. Like no discussion, no, hey, these are the things you might be going through over the next 6 to 9 months of your life.
yeah. Yeah.
Right. You're supposed to be like in the clear, and it's like that's not true.
I'm not back to normal at all. Nothing feels the same.
Right.
Everything's different.
Right.
Um, and I
Like you
am
get
one of
signed
the
off for sex and then like
yeah,
what?
right? And I'm probably one of the on the fewer end of women or the smaller end of that pool of where postpartum recovery was very easy for me. It was a very smooth sailing process, right? 6 weeks was really extended, way more than what I felt like I needed as far as like getting back to feeling normal sex, other things. Emotions, different story.
Right.
Nursing, different story. So, and hormonally, you know, little things like there. But when I had my hysterectomy, I was way too unprepared because I was like, oh, yeah, I bounced back, no problem. It's
Right.
a different story getting an organ pulled out from you that, you know, your body doesn't have this chain reaction of, um, hormones to help you heal through. It's like, whoa, we weren't ready. Yeah, I wasn't prepared for that. And I feel just very naive back, like
Yeah.
thinking back of like, oh yeah, I'll be fine. I'll take a week off.
Yeah.
Um, yeah,
Yeah.
no,
As
bodies
someone
go through
that, yes,
crazy things.
yes. As someone who does a lot of minimally invasive surgery as well, like that's another thing, managing those expectations of surgical recovery on so many fronts, not just,
Mm-hmm.
you know, again, psychological, physical, like there's all these aspects to recovery in general. And then aiding that process too, right? Like if you're going to be doing something that potentially disrupts hormones, how are we fixing that? It's not like a, okay, we're pulling the plug on your hormones, see you later. Like it's, what are we doing? You're a young healthy person. Like how do we balance that? How do we support that as your body
Mm-hmm.
sort of adjusts, right? Like so there's that aspect of it too that's also important. And then that brings us to the next group of women where it's menopause, and literally women in menopause are told it's supposed to hurt, get over it,
Oh, yeah.
right? And it's like you shouldn't want sex after menopause. Like why
That's
would
your
a
body telling you to
postmenopausal
shut
woman,
down. Yeah,
right?
no.
You don't need sex anymore. It's like that's such a misconception, right?
Mm,
It's like we spend so much of our life now, especially given life expectancy is so much longer, right? How much of our time is in menopause or going through perimenopause or whatever, or hormones are changing, and you're just supposed to like flip that switch off and put it in a box and like never think about it, never want to enjoy it,
Boo.
or
I don't
right?
want to sign up for that life.
Exactly.
I
It's
want
just
to
not
be very sexy and pleasurable and having all of that fun and really in tune with my body until the day I can't
right.
breathe. Like my heart stops, right? Like I want this to be forever because such a huge piece of my life. But to say that just because of this one trigger that we're all supposed to go through, then we're done. I think that's just so sad. Yes.
Yeah. I
Shame on
think
that
that
misconception.
oh, it is. And that's, that was another reason I actually got certified as a menopause practitioner too, because that was another thing. How do I let women know that I can focus on you on this at this time of your life? Like we can address all of those needs, right? So not just, so many aspects of like your health changes with menopause and perimenopause and the years leading up to it because of those hormone fluctuations. And so really being able to say, let's improve upon that. Let's, really focus on that. And if it's a priority for you, really focus on it, make it important, like not something that you just put away and, have to stop thinking of. And
Yeah.
it's no longer part of your relationship or part of your self. Shouldn't be the case at all.
Yeah. Yes. More women, how do we navigate that time in our life without giving up a piece of who we are?
Yes.
Love
Right.
that. Love that. So, other misconceptions that can either prevent people from going and seeking support and help and intervention that you've run across in your practice?
A few different things. One, you could think about from that menopause conversation about what treatments are available, because many people are just told there's nothing and nothing that
Mm.
they can use, and that's not true. There's a lot of things they can use. There are natural things they can use. There's lubricants that they can use. There's hormonal therapies that are incredibly safe and well tested that can be used. Like, so there's a whole spectrum of treatment options, but many
Mhm.
women don't even seek that because they have it in their head that there's nothing to do for this. And that can
Yeah.
be coming from a medical source or, prior generation, like whatever the sort of, this is your lot in life. Like I went through it, you can
Just
go through it too.
right.
And it doesn't need to be the case.
Yeah. Well, gosh, even, my youngest who's a girl, my only girl, so she's 9 and she's talking about her period all the time. She's like, "What is it gonna feel like? What is it gonna look like? What am I gonna see? What am I gonna notice?" Like she's very, very, very curious. Like every time we have like a down minute where her brothers aren't around, she wants to know more. I'm like, "Oh my gosh," like almost to the point I'm a little worried. Like, are you scared? Are you excited? Like, don't don't get excited. This isn't fun. I
Right.
also don't want to have my own like limiting beliefs. I hated my period, hated myself on my period. Like it was just disgusted, l- loathed every, minute of that week. It was a really tough time for me.
Yeah.
Also, I'm like, okay, I feel a little validated knowing I had endometriosis and there was other things that just made
Yes.
it awful. Plus the stigma of you're dirty, you're gross, other things too, and working through that. So I'm so glad she's not scared about it at all. She wants, she was like, "Well, what's a tampon and how do I use this? And let's talk." And I was like, "Well, you're going to probably want to take this in stages, but just from what she has that I didn't have and how we can change those generational things, that's just the start of all of those hormones. We can get there to where the hormones change towards our end of our life in menopause. Hey,
Yeah.
just because you went through that and that wasn't an option or the education wasn't readily available, we have Google, who isn't the best. Be very careful with what you Google, but way more than, what my grandmother had available going through
Right.
that, what my mother even has.
Or a mother. Yeah.
Yeah. And so it's really cool to have that. But now deciphering what's good quality information versus not, like that's going to be,
Right.
down the
Well,
road,
I
or
can
it
say
needs to happen right now. But
your daughter is very lucky to have you and have
mhm,
someone as open and supportive and, there for her during that. Cause you're right. Like, it probably a little fear, probably a little excitement, all of those things, but she can bring that to you and talk to you about it. And you know what I mean? Like, so I feel like that's what that generation needs. That's what we need to
mhm,
be able to put out there. And you know what? Sometimes the woman that I'm seeing isn't necessarily comfortable to do that or be that for their daughters, but they're
mm,
asking me questions about it. And they want to know, okay, what can I say? What can I do? What are there resources? Can I bring her to see you? Like, yes, actually, yes, you can actually bring. It doesn't need to be invasive exams or anything like that, but you can have a young girl talk to a gynecologist and just hear about whatever it is and get their questions answered, right?
yeah,
Or point them towards good resources online to be like, okay, you can go to this site and talk about this, and learn about this in a educated and focused and truthful way. So
quality,
just
yes.
yeah, quality info. So just the fact that you're right, those things are available to our fingertips, and we can be open in whatever way we're most comfortable for that generation to also take away that stigma.
Hmm. Yeah. I mean, just like we didn't have a choice to, women to start our period, we don't have the choice to like avoid menopause either. And, like for her, my daughter, and from me when I was younger, I went to my mother, right? I asked her about periods and what to prepare. And I want to, point out that by the time we go through menopause, we might not have our mother around, and building that system of trusted people to talk to, being able to have, you know, providers like yourself who are very open and honest and ready to have that conversation instead of like, well, what's wrong with you? If nothing's
Yeah,
wrong, we don't need to have this conversation. I have 10 other patients right behind you. Please get out of my office. And it's just a very, um, illness centered model. And so I
yeah,
love just how you were like, yeah, bring your younger daughter in who has questions. I will happily talk to them. I think we need more service providers that have that type of mentality and our willingness. And then just to get involved in products that you can back, like Playground and the lubes and lubricants that they have, knowing that, okay, quality trusted doctor is backing this. I feel really good about purchasing this. I feel really good
right.
about using this. Because so often it's a lot of guesswork
Yeah,
around a lot of those things. And I'm not saying that there isn't quality things out there that aren't, that don't have a doctor's backing or anything, but it just makes me feel better if I'm looking at any type of intervention. If there's not a medical doctor that's backing whatever it is, we hear about pills and all sorts of fun things and wraps and who knows it's out there that hey, there was this scientist who invented it. I was like, "Okay, well,
right,
what is the medical, community looking at this?" Like, I'm
right.
still a little hesitant. Um, so I love that you're willing to point folks into those directions of quality information and products out there for what they're looking for.
Yeah,
And they can come to you for that. Um, so we know that stigma is a big piece, like the shame or like the fear, the discomfort, the embarrassment of like, oh my gosh, I'm going to talk to my doctor. I was even noticing like, I don't really hold back on this podcast. It's one reason it's a podcast. And I was like, I'm a little embarrassed to talk about how my husband railed me. Like, and then it kind of hurt. But if, like quality information and for me not holding back or being able to tell you exactly what's happening instead of these like, let me skirt around the actual issue or try to use fluffy language even because I'm embarrassed. So it was just kind of funny how I even caught myself right now. I'm like, this isn't typically me.
yeah,
But is it because I'm in the presence of a medical professional that I feel the need to do that? And so it was just kind of interesting. My own stigma and my own history working with medical professionals kind of got in that. I got in
right.
my head a little. So it was just kind of funny. But anything you noticed or even have a suggestion for folks as they're turning to a medical professional for some of these more intimate, somewhat maybe embarrassing or uncomfortable conversations?
So it's a little bit about seeking out that good fit of like being able to talk to someone openly, right? And that doesn't mean that your provider is a bad provider, like your doctor is a bad doctor because you're not comfortable talking to them about sex, or they're not comfortable talking about sex. That's not true at all. They're probably great clinicians. They're probably really well trained and have, amazing education and experience and all those kinds of things, and probably got you through a lot of difficult aspects of your health, right? But that doesn't mean everybody is necessarily comfortable talking about this. So it's not wrong. It's like some people come talk to me about menopause or endometriosis or sex or vaginismus, which is like another aspect, muscle tightening with sex, or just pruning or whatever. And they almost feel like they're cheating on their doctors. And I'm like, you're not cheating on your doctor. You can go see your doctor for everything else, but we can have a conversation about this. Like we can focus on this, and we can, you know what I mean, and treat it like it's its own thing, which it is, right? Like focus on it in the same way that you would give attention to anything else. And I think that's another thing that, it's not like you're discrediting or insulting or, you know, not valuing your existing provider or doctor. It's like, it's just, some people just have their limits. That's it. Like they're just not comfortable talking about it, or it wasn't part of their generation of training, or whatever it is. It's not something that they were able to seek out. And so what I would hope, and this is what I'm also kind of hopeful, that we as, medical professionals will be able to direct patients a little better and women a little better. It's like, you know what, I'm not comfortable talking about this, but let me give you some resources or names of people that you can absolutely spend some time with and will help guide you. I don't think we quite have that nailed down in our community yet, but it is something that is starting to happen in some ways, like the surgical aspect of it. For example, like there will be doctors that very commonly refer to me for surgical consultations, and the patients will go back to them for their regular GYN care or other care like that their body they need. But it's not like it doesn't need to be completely separated and exclusive. So really finding that, making it a priority for yourself, making it something that you want to talk about and you want to focus on and pay attention to, create time and space for, not just in your life, but also like when you go talk, when you make a visit to talk to a medical provider about it. And I say medical provider because it's not necessarily just a doctor, right? It could be a nurse practitioner, it could be a therapist, it could be a wellness coach. Like, I mean, there's so many different ways that you can focus on your own health, where it's somebody who is trained and educated and passionate about this topic, and they're not going to dismiss the issue.
Yes. I think that's so important, and to give people that permission. Just like you said, you're board certified OBGYN. You're not doing the OB side. Wow, all the letters just wanted to come out of my mouth. You're not doing the OB side right now, but doesn't mean you can't support someone. And you are so heavily involved probably in the community, and you know other people, and you're like, that specific need, I have someone who would probably be perfect. And for doctors knowing that and being involved in their own medical community and others, and knowing, sure, I have the same certification as someone else, or I do this. Like for me, being board certified health and wellness coach, I actually center on body image more than anything else. And it doesn't mean I don't see other people for a lot of other things and support that, but that is what I've dedicated a lot of time. And I can pull things, we can go deeper in that area. Just like you're saying, you can go deeper in a lot of different areas because you've taken that time to specialize. And this is a giant world. Women's health in general is massive. So just OBGYN, those are massive worlds that, gosh, you could probably center and go into school for 40 years and still have a ton to learn about one very specialized area. I think it's just really neat that, as maybe the medical community and service provider communities understand that we are all there for the same goal of the health and wellness of individuals and everybody. It's easier to provide referrals. It's easier to say, I love that you trusted coming to me. I want to make sure that you are in the best care possible. And that looks like maybe going to this person for this. It doesn't mean I'm not willing to. I think that's just a big one. It's just affirming, like, not my problem. Go to this doctor. Because I feel like sometimes people do feel passed around. Let me go to
Right.
my doctor because this hurts. Oh, well, it's this. And that doctor may be wanting to shrug it off. Either they don't have time, or just the know-how. And instead of saying, hey, that's actually not my area of specialty, but I know someone who would absolutely. I think that's also, how can an individual advocate for their own needs too?
Right.
And that's hard because we're used to, you have one doctor that's supposed to
Yeah.
just tell you to go to these other places, and then you just kind of get passed around and you're like, I don't know. I'm not the,
Right.
the person who knows. That's why I'm coming to you. And I think that's one reason I avoid the doctor at all costs, until I'm like, I have to go.
Yeah.
But that's me. I think it's frustrating. So for you, how do you get the word out that this is what you specialize, this is what you're great at, come to me for these things? As a service provider, what have you noticed that works well?
Yeah. So a lot of it is word of mouth.
Mm-hmm.
I'm also, like I said, so what I mean when I say I'm like a menopause certified practitioner, it's the North American Menopause Society is an amazing resource. Menopause.org. It's available and open to everyone. You can go, you can search treatments and what are the latest studies on all of that. But they also have a provider database of physicians
Mm.
and nurse practitioners and physician's assistants, I believe too, that have actually done the certification exam and actually keep up their education. Every 2 years. You have to recertify either by doing the exam or getting credits. So again, keeping up with the latest information. And you can actually look in your area for providers. So I'm on that site, and so I will have often individuals that are seeking this specific type of care and coming. And then the other aspect of it is, I think, like I said, word of mouth, in the sense that because I am so open in each interaction, that it's something that's easy for someone to say, you know, who can I talk to about X? Like, okay, yes, I know I've actually spoken to this person about
Mm-hmm.
X. So I know, you're going to be received well. And so that's another aspect of it. And then, I dabbled in social media and I did my own website, and I've tried to put information out there just to be able to say, if you're looking, here's where you can find even a snippet of it. And then let's have a bigger conversation surrounding this.
Mm-hmm. Yeah.
So yeah, it is a little bit of seeking. But it's also, like you said, having giving yourself permission to seek that out, and actually, like, there's nothing wrong that you want to spend time with that or fix it or help it or improve upon it. And I think, different aspects of women's health, and then particularly sexual wellness, is often underlooked, as even just in our own lives, right? Like, it's just not, it doesn't hit the top 10 priorities of all the things that we're worried about. It's just not on that list. But then when you're in the moment, it's distressing. So, and that carries over. So you almost have to, like, pay attention to that, sit with it,
Mm.
really embrace it, and just say, you know what, I want to make this better. How can I make it better? And then start looking for the resources. But I feel like a lot of people, again, are just kind of, one, because of the stigma around it and kind of commonly held misconceptions, able to sort of just put it away in a little box and not focus on it, not think about it.
Yeah. Yeah. And validate, call it out, be able to accept that it is something we do want to change, and it may take some effort. And sometimes in the moment you're like, oh, this sucks. But gosh, the effort to try to find an answer also sucks.
Yes.
What's your heart that you want to do? Is this worth advocating for yourself? And then finding all other answers, you're like, wait, those are all related. Painful periods, painful sex, then my back pain, my leg pain, my headaches. I had no clue they were all, like, you start to find more information. And um I think we're kind of starting to see more people call that out,
Yes.
especially on social media. Hey, this birth control, I noticed this. And it's
Right.
like, oh wow, I'm so glad someone did say that. We also have a lot of limitations on social media. um, around sex and sexual wellness. I think, censorship is still a thing that limits proper channels and good information out there. I know the podcast has been, I'm like, I'm just going to stick to memes. Because anything I feel like I try to do, I get like the slap hand on like from social media, like you can't do that. And I'm like, oh my gosh. But you're gonna get like this meme that's actually probably not accurate and it's probably adding to more of the stigma, but it gets people interested. And I was like, if that gets you to the page to tune into the podcast, deal. But social media is a whole nother thing, I'm sure. So I
Yeah.
love when you're like, I dabbled in it. And it's like, I feel you. I feel you. It's not fun. Um, but I think it's helpful to listen to yourself, listen to others, and be open to different paths.
Yeah.
Gone are the days we had one doctor that was our entire life, that knew us, that knew our history, going to go and advocate, knowing what other specialists are out there, other interventions are out there. So the one website you shared, menopause.org, sounds like it's going to be one that I'm going to start exploring. So I'm ready and not being caught off guard and being like, oh, that's what all that stuff was.
Yeah.
I wish I had known that. And now I had how many months or years of displeasure and discomfort and,
Yeah.
me
And
being
I
ornery
mean,
with everyone.
well, I mean, so you sharing your history of endometriosis, I mean, that right there is a huge population that has been the gaslighting that went
Mm,
on for women that had painful periods, pain with sex, all of those things. Same thing happens with perimenopausal women, right? Like, it's like, this must be in your head. This has got to be a psychiatric issue. Like, you're 45, you still have your period. So what's wrong with you? Like,
yeah. Midlife
it's,
crisis, whatever,
right. And it's
Mm,
like, no, like there's stuff happening. Like what's going on with my body? And I can go on and
mm,
on about menopause, but like, so average age of menopause is 51. Perimenopause starts 5 to 7 years before that. So you're in mid 40s, like late early 40s, where you're starting to have hormonal
yeah.
fluctuations affecting your body in so many different ways. And it's like there's not enough light shown on that. And that's the same thing that I see in like the endo and the fibroid community, where they have this issue and it's like, it's not that bad, it's you're exaggerating, you're doing this for attention. It's
Everyone else has periods and
yeah.
they can walk just fine and they can go to school. I'm like, I couldn't even stand up
Yeah.
straight. I
Yeah.
remember just being so miserable. And I'm like, well, I guess I have to push through because no one else is giving me a choice and this is
Yeah.
awful and I'm just gonna
Yeah.
avoid it. And I think that's why that whole like state like I
Yeah.
hated my period. And it was all the time. As soon as
Yeah.
I think I'm done, here it comes again. And I'm like, oh my
Yeah.
gosh, try to plan your vacations around your period or your
Right.
cycle. No, the stress of the cycle or the period or oh my gosh, of the planning the vacation will cause that to come on. I was like, oh,
Yeah.
I'm done.
Right.
But
Yeah. And so like all of those,
yeah.
all that is real. Right. And
Yes.
there's so many. And so when you were saying, even just there's so much more information out there, I think I love that there's now communities surrounding these things too. And like
Mhm.
around whether it's endo or menopause or sexual wellness, just the voices of just individuals and women going through this really being put out there, seeking answers, demanding answers, right? Demanding that it be paid attention to. And I agree, it should be like that.
Mhm.
That's what I think has been missing all these years, and that's why you could get away with saying, just put up with it, deal with it. Everyone else has it. Like it must be in your head, or attention seeking or whatever.
Yeah. Yeah. Well, it's just great to know that there are folks like you out in the medical community who are bridging that gap from that very clinical side of let's, prevent and treat illness to also promote wellness and pleasure and other things. So, with your work with Playground, and where can people find more information about you and Playground?
So my website is drmatthewsgyn.com, and then Playground also has its own website. So that both of those areas we can visit and see more information. There are amazing blog articles as well on Playground. We have a really cool sex and wellness council that is not only people involved with the program, but like other people that also sort of promote and are excited to talk about sexual wellness and health, that really kind of brings that to the forefront.
Yes. There's folks out here. We're all screaming from whatever soapbox we can get on top of.
Yes.
But I love it. And we are all finding each other. So thank you so much for your time coming on the podcast, sharing all that wonderful information with our listeners. And for our male listeners who hung out the whole episode, I just want to say you're amazing. Thank you so much for taking the time to be educated for the women who are in your life, because you might have a mother that's going through menopause. You might have a partner who's suffering from some of these things that don't think that feel like the medical community has turned their back on that need. So advocate for them. I want to say thank you for anyone and everyone who's tuned in. You can find more information on the podcast at saltysexcast.com. We're on all major listening platforms. I'm sure you're listening from your favorite one, but feel free to check us out on our videos. We are now having our video on YouTube, but also Spotify is video podcast. It's so much fun. So, and a super special thank you to all of our Patreons from who are being patrons to the show. And if you are interested in becoming part of that Patreon community, you can find us at patreon.com/saltysexcast. You do need to put in that whole title. I guess because we're adult content, they want to make sure you're smart enough to put it in all the right ones. But anyway, thank you everyone for tuning in. Thank you so much, Dr. Mathews, for joining me. And I'll see you all next week. Bye.
Thank you for listening to the Salty Sex Cast. Ready for round 2? Find us on Facebook.